Welcome everyone to day 2 of the virtual Lifespan Respite Grantee and Partner Learning Symposium. Some of you may be just joining for the first time today and may even be new to this whole bring, brag, and borrow strategy. But for those of you who don't know me, I'm Jill Kagan with the Arch National Respite Network and Resource Center. I know that we are all still absorbing the great information and all the resources we received yesterday from all of you, and we're really looking forward to today's presentations. We really hope that, and we know that you will harness the great energy and the shared resources and best practices from the event as you move forward with your Lifespan Respite Grant activities. Marcia, I think you can go ahead and bring up the slides. You can go to the next slide. Again, all of you are super Zoom experts, but I've just posted a few reminders about Zoom. In the interest of time, I want to let you all know that we'd like to save all the questions until all of the presenters have presented. We've broken it up into 2 sessions today. So after the first session, we'll have Q&A, and then actually, no, I don't think we do. I think we save all the questions and answers for the end, but we'll see how our time goes. But I want you to know that you can feel free to post a question or a comment in the chat at any time, and we'll either try to respond to you in the chat or we'll get to the question at some point. Again, if you get disconnected, just log back in with the link you received in your confirmation email. But if you're still having trouble, please feel free to contact Marcia O'Malley, who we're so fortunate is serving as our tech guru once again today. You can send her a chat message or text her at the number on the screen. And Marcia will put her number in the screen so you'll have access to it. The next slide, please. To introduce yourselves, please feel free to put your name, say hello in the chat, and let us know what state you're from. And if you don't mind, let us know about one new partnership that you may have formed in the last year as you're working to advance a respite in alignment with your work to implement the national strategy to support family caregivers. I guess my question there is, in your work with the national strategy, has it really helped you reach out and identify some partners that maybe you wouldn't have worked with before? And if there's one that's particularly interesting, let us know about that in the chat. Next slide, Marcia. I wanted to remind you, in case you weren't with us yesterday, I made the same announcement yesterday. I want to remind those of you who plan to be with us at the in-person Lifespan Respite Grantee and Partner Learning Symposium in Albany on May 21st, please register at this link. You may have registered for the National Lifespan Respite Conference, but this event requires a separate link. It's really very helpful for us to have a head count, not only for food, but just to know how many handouts that we need, and to know how many people are coming, and also so we can prepare a participant list so you'll have everyone's contact information. Next slide. Today's agenda will basically follow the same structure as yesterday, with bring, brag, and borrow at the center of the day, and a time for questions and answers with your colleagues, and we'll take a self-care break too. As a reminder, all of the PowerPoints, shared documents, any resources, videos that you shared have already been posted on the Arch website, and you can find them at the link at the bottom of the screen. And again, Marcia will put the link in the chat. We want you to be able to access those documents as people are speaking. For those of you who are presenting today, we're going to be sharing the screen. Marcia's going to be sharing her screen on our end and advancing your slides for you. And don't forget to just let her know when you need her to go to the next slide. Does anyone have any questions about today's agenda or the schedule? If you did not get the schedule, in advance. I did send it around to you slightly revised on Monday. You can access it at this link on the screen as well, and it'll be in the chat. So you'll know exactly when you're presenting. Okay, next slide, please. I just wanted to do a little bit of a recap from yesterday. We did ask you what you'd like to get out of the symposium, and I pulled some of the highlights out of the chat. Not surprisingly, all of you want new ideas and new connections and best practices. Specifically, you want information about how to provide group respite, engagement strategies to reach more family caregivers, resources for the future of caregiving and respite work, ways to support caregivers from diverse communities, resources for caregivers of people with developmental disabilities who don't qualify for public assistance, and people to connect with at the national conference in a few weeks. I thought that was a great thing that someone wanted to get out of yesterday. I think we got a really good start on meeting many of those needs yesterday, especially about innovative ideas. We learned about respite models for children that use students as respite providers in Colorado and Rhode Island. We learned about respite vouchers for kinship caregivers in Virginia. We learned about creating awareness and strengthening supports for caregivers in Delaware's state plan on aging. And by the way, she did send me all of their marketing materials around their caregiver messaging. And I haven't had a chance to post them yet, but we will post them on the Arch website and let you know when they're available. We learned about the restructuring of the State Respite Coalition in Washington to increase participation of family caregivers and to meet all 5 goals of the national strategy. They're very ambitious in Washington, which is great. We learned about connecting family caregivers to trained respite providers through a new respite registry in New Mexico. And then we also learned about piloting a food box program as respite in Montana, and there was a great deal of interest about that initiative. We have even more to look forward to today, but most importantly, you know, as I think all of you know, you'll learn about who to reach out to if you hear something of interest that you want to learn more about, or if you have programs or resources that you want to share with a state that's engaged in similar activities. You are all the most generous network I've ever known, and your willingness to share your knowledge and experience with your peers, and we are really very proud to help facilitate that. Next slide, please. Does anybody have any comments about yesterday's presentations or wanted to follow up on anything from yesterday? Marcia, if you see anything in the chat related to that, would you let me know?
No, I do not.
Okay, great. Well, let's go on to my update. I do like to every year share with you some of the more recent products that Arch has developed, as well as review some resources that we've had for quite a while that maybe you're not familiar with. So we can go to the next slide. I know that some of you are so new that maybe you don't even really know who Arch is or what we do. So I prepared this slide just to give you a brief intro. We are funded by the Administration for Community Living to house the Lifespan Respite Training and Technical Assistance Center. We use that center to provide training and technical assistance to the Lifespan Respite Care Program grantees and their partners, but also to the respite field more broadly. We also provide lots of information to family caregivers about how to find respite by linking them to you, or if they're living in states that don't have coalitions or grantees, we offer the online National Respite Locator Service, as well as a series of fact sheets that we have that are specifically targeted to family caregivers to help them find and use respite. And then finally, our National Respite Coalition, which is the policy division that advocates for respite at the federal level. You may occasionally see an alert or a legislative update from the National Respite Coalition about what's happening with lifespan respite and other caregiver policies. Next slide. Again, if you're new to the program, or even if you would just like a refresher, I would strongly recommend that you visit the Lifespan Respite 101 toolkit on the ARCH website. The toolkit has lots of information on the background of the Act, on the purposes and requirements of the program, including congressional intent. We also list all of the past ACL notices of funding opportunities, because this is a great place to learn about what ACL's expectations are for the program. We have information about building and maintaining respite coalitions. And our newest product, we just developed an orientation guide that really pulls all of this information together in one succinct and handy document that we're hoping, you can just keep on your desktop for reference, and it'll help you more easily navigate the website to locate essential information, to locate specific resources related to questions that you might have, or just to learn more about the Lifespan Respite Care Program and its purpose. And as we move through this, Marsha's going to put these links that you're seeing on the slide, she'll put them in the chat again so you can have ready access to look at some of these documents. The next slide. One of our obligations as the TA Center is to maintain a directory or a database of lifespan respite grant activities. And you have all been so kind. I know in the last few months, we've come to you again to share your final reports that you submit to ACL when you complete a grant period, or you've sent us your actual proposal from your grant application. And we summarize those and post them on the website so that they can be shared with your colleagues. They can be shared with policymakers who are interested in what's happening with the federal dollars, or just the general public. So thank you all very much. We're in the process right now of updating those, and we should have some new summaries and new documents that are posted on the ARCH website, hopefully by this summer. But we're continually trying to keep that as current as possible. Next slide. I want to talk now a little bit about our learning collaboratives, which is really at the heart of our training and technical assistance right now, because we've learned from you that what's most helpful is the chance to connect with each other, to engage in peer learning. And so we've really fostered these collaboratives and made them available to you. The most recent one is the National Strategy Learning Collaborative. The collaborative has been meeting almost monthly since February 2023. So it's more than a year now that we've been meeting to learn about and support each other's work as we're all working collectively to advance the national strategy to support family caregivers. Since we first began, we've heard from experts in the field about the purpose and content of the national strategy, and then also on specific topics like state legislative advocacy, state strategies to deal with the direct care workforce crisis. And then in the last 6 months or so, we pivoted a little bit, and we've been focusing on developing and strengthening your leadership skills that will help you champion the national strategy goals in your state. And we pepper that with lots of examples of what you are all doing around the national strategy. We give you a chance to highlight a leadership skill that you're demonstrating as you develop your lifespan respite grant activities. Some of the products that have actually emerged from the collaborative, we did develop a policy to practice brief. Susan Summers was the author of this wonderful document. She was inspired by the national strategy to talk about the role of respite in the national strategy. And I think it really provides some beautiful context for the work that we're trying to do through the collaborative. We also, with support from ACL, a special projects grant that was awarded to the National Academy for State Health Policy. We've been working very closely with them on, again, additional ways to advance the national strategy. And we worked in collaboration with them and with lots of input from all of you to develop this respite resource guide that was designed for state agencies that want to implement respite activities, Medicaid agencies, public health agencies, aging and disability agencies. And again, I want to thank all of you for contributing significantly to that guide. And I hope you'll be able to use this guide in your own state to get some traction, perhaps with some of your partnering state agencies. We've also, since the very first month, we've been cataloging the contributions and the progress that you all have made in implementing respite services and caregiver supports that help advance the national strategy. And we've been cataloging these in a matrix. And many of you, thank you so much for those of you who have already sent us updates to the document. It's a working document, so we're trying to keep that as current as possible also. And we'll be using that to inform the work of the RAISE Family Caregiving Advisory Council and the Advisory Council to support grandparents raising grandchildren as they work to monitor progress made by states and communities in implementing the national strategy. I think we're going to be the most organized of all the state agencies to be able to submit this information to them. And as I mentioned, now we're operating from a framework for development and utilization of leadership skills that was developed by our facilitator, Cheryl Donnell. So if you haven't seen that framework for development and utilization of leadership skills, I urge you to take a look at that on the website as well. And I see I didn't put a link to this Learning Collaborative, but we do have a link on one of the other slides about how you can access all of the Learning Collaborative materials. Next slide, please. Any questions about the national strategy one? Because that's the most active collaborative right now that people are engaged with. You can come off mute too if you want to ask. Okay, we can move on to the next slide. We also have our Respite Voucher Learning Collaborative, and we're so fortunate with this particular collaborative that we have some peer leaders, Aida Stevens and Talina Ford from Oklahoma, and Tracy Kahlo and Barb Kumjian from Lifespan Respite Washington, who have been helping us identify issues that folks want to talk about during the collaborative, and it's mostly around implementation issues, ways to reach family caregivers, to let them know about vouchers, administrative issues, lots of issues. We tackle them. We try to meet 4 times a year at least. We've done a couple of surveys in conjunction with the Oklahoma program. They've helped us survey all of you to gather information about how you implement your programs. And then at the last grantee meeting in Madison, we released a respite voucher guide that was developed for us by the Applied Self-Direction, who are experts in self-direction. So it was really wonderful to have their guidance and information. And the guide has several in-depth case studies of lifespan programs that are implementing respite vouchers. And then out of this tool, out of the voucher guide, New York came to us and said, do you or does anybody have a readiness assessment tool for determining if a program is really prepared to launch a new respite voucher program? Because they were considering expanding their lifespan respite voucher pilot program to the AAAs within their state through the National Family Caregiver Support Program. And we got really excited about this. And we said, we don't know of anyone who has a tool, but let's work together and develop one. So we took a lot of the work that they had already done in trying to put an assessment tool together. We brought in Applied Self-Direction as the experts again, and we've got this fantastic readiness assessment tool that can be used by those who are considering starting up or enhancing or expanding a respite voucher program. Next slide. And just so you know about other learning collaboratives that we run, we have a volunteer and faith-based respite learning collaborative that also we try to meet 4 times a year. And we started off highlighting some of the fantastic work that you are all doing around volunteer and faith-based respite. And more recently, we've been bringing in outside national and state and local programs that we're aware of that are administering some wonderful initiatives. That learning collaborative functions a little bit more like a webinar series, but we'd love to get back to um, more sharing and peer networking within that collaborative as well. The Sustainability Planning Learning Collaborative that's run by Susan Summers, I think they've been meeting since 2017, and it's a very loyal group of states that meet monthly. We are in the process of reconfiguring that learning collaborative and taking some of the experts that have now formed within that collaborative and putting them out into the field to mentor and share the work that they've done with the rest of you. So keep your eyes peeled for the next phase of what the Sustainability Planning and Learning Collaborative will become. And then the final one that I just want you to know about is more of a, we're not the leads on this, but we partner with the Break Exchange and support their work to run a student respite program collaborative. And this is a very informal group of folks that come together from academic institutions, from community-based respite programs, to come together to see how they might be able to build some of these programs that use student nurses or social workers. You learned about 2 of them yesterday in Colorado and Rhode Island. And Kim Whitmore, who heads up that particular learning collaborative, has just developed a student respite program toolkit too that she's also going to release at the national conference. So you'll learn more about that in the coming month or so. Next slide. Our most recent work that I hope you've been aware of, because we've been promoting it quite a bit, is the work that we did with the Georgetown University National Center for Cultural Competence to develop the Cultural and Linguistic Competence Assessment for respite organizations. That also has a detailed guide to help you carry out an organizational program or coalition assessment of your own readiness to offer culturally and linguistically competent respite services. And I know that many of you are already doing incredible work in this area, but I have to say there's always so much more to learn in this arena. And Tawara is an amazing person who has personally opened my eyes to many, many issues, the language that we use, the way we gather with people, everything is intentional. And there's just so much to learn from her. And I hope you'll take some time to look at these documents. We did hold a webinar just last week with Tawara, who introduced the tool and walked us through the tool and the guide. And I'm just so excited that she's actually going to be coming to the in-person learning symposium in Albany to spend some time with us and do a deeper dive on using the tool. And I think I mentioned during the webinar that we had last week that if you're going to be at that event, you'll really get the most out of that session if you spend a little bit of time familiarizing yourself with these documents before the meeting. Or if you were not able to attend the introductory webinar, I would strongly suggest you take a little bit of time to listen to it. The recording is now available on the Arch website for you to be able to do that, and the link is on the slide. We're just very, very excited about this work and hope you'll join us in promoting it in your own states and in your own coalitions. Next slide. Just briefly, I always like to let you know that we've released a couple of new fact sheets in the past year, if you haven't seen them. One is on volunteer respite that really focuses on new resources that became available. It draws a lot on our volunteer respite manual, which is a much more in-depth guide to developing volunteer programs, but this is a quicker, shorter version of that with lots of new links and references to best practices in volunteer respite around the country. And then we also developed a more in-depth fact sheet. It really is more like an issue brief on respite for individuals with autism. I mean, I think we get more calls here at Arch from parents looking for respite for their children or their adult children with autism than just about any other group, because those services are so difficult to find, especially if their children have any special behavioral issues. It's just, we have a tremendous shortage of respite for this population, and as much information as we can get out about it to the world, the better we can help to advance those services. Next slide. And if you need to find those fact sheets, you can just search for them in our library. We have a resource library on the Arch website that's very easy to search for documents. Now I just want to talk about a couple of more overarching respite initiatives. The first one on the next slide, I know you've heard a lot about already, is again, the Special Projects Grant that National Academy for State Health Policy was awarded from ACL. And part of that was subcontracted to us to develop a competency-based online entry-level respite provider training. And we did this in collaboration with the Respite Care Association of Wisconsin. They have been the leaders in respite provider training for more than a decade. But they already had some wonderful respite provider training materials and expertise in this area. So we worked with them about, we first developed some competencies, core competencies, by convening an expert work group that are specific to respite providers. And we use those core competencies to enhance the Respite Care Association of Wisconsin's training. And we piloted it. We actually field tested this training in 10 different states. And the 10 states, the 10 pilot sites that participated also worked with the Respite Care Association of Wisconsin and with Arch to develop some unique recruitment strategies and marketing tools. And we're just so excited now because we're finishing up the evaluation from the pilot, and we've developed a replication toolkit. And we're going to talk about that in depth at the Lifespan Respite Learning Symposium, as well as at the conference. But all of you, if you're not able to come to that, you'll receive information about the replication toolkit and about how you can use this training in your own state if it's something that you're all interested in doing. Next slide, please. The next initiative Arch has been very engaged in since probably 2013 or 2014, when we first convened an expert panel on respite research to take a look at how we could build the evidence base for respite. We just need more information to demonstrate that respite, no matter the model or no matter the age or the condition of the person being cared for, to document the benefits to caregivers, to care recipients, and to society as a whole. And so they developed a wonderful framework for conducting research and a research agenda that we published. We held a respite research summit in the fall of 2020 to share everything that this expert panel had learned and how much they had accomplished at the time. And we launched a new committee for advancement of respite research at that summit in 2020. And they've been meeting for the last 3 or 4 years to go to the next phase of advancing this respite research work. And we're just so fortunate to have some really prominent researchers and advocates and funders on that committee working with us. And we're going to report out on all of our accomplishments at another virtual respite research summit this fall, scheduled for October 20, the afternoons of October 28th, 29th, and 30th. And we hope that you'll all be able to join us for that event. Part of our research initiative is that we try to put out new information that we learn about respite research in a consortium update that comes out 2 to 3 to 4 times a year, depending on how much new research is coming out. And we also do a lot of our work, again, in conjunction with the Break Exchange, which is focused on internationally connecting researchers to respite programs to further evaluation and document the benefits of respite. The next slide. Some of the products that have emerged from our respite research initiative that we're really excited about. We updated again our annotated bibliography in 2022. That includes all the latest information on the newest respite and crisis care research. And that work continues to help inform the work of our Committee for Advancement of Respite Research, but it's available to all of you as well on the ARCH website, and you can search for it. There's a search engine that you can search for specific studies that look at different age groups or that are literature reviews. We also produced one of the work groups of the Committee for Advancement of Respite Research is focused on cultural and linguistically competent respite research. And we did an environmental scan of resources that can help expand culturally and linguistically competent research. And that environmental scan has really become the basis for a new collaboration we have going with the National Center for Cultural Competence and Tawara Good at Georgetown. She's taken a look at the environmental scan and seen where all the gaps are, especially around respite research. And she's going to be developing a guide for respite researchers on culturally and linguistically competent research. And we'll be releasing that at the virtual summit in October. So we have a lot of new wonderful products that are coming out. Kim Whitmore, who facilitates the committee, along with other members of the committee, developed a white paper on measuring the value of respite and a framework, a value of respite model for conducting this kind of research. And it will soon be accompanied by a companion paper on the use of common data elements. We'll be recommending common data elements for respite-related research that will align with the value of respite model. And the aim of using common data elements in research is really to allow us to conduct more meaningful comparisons of data across and between studies, across and between respite models, different types of respite, and between study populations across ages, disabilities, and culture. And again, to look at these over time. So we feel like these two papers together are going to really help advance the field, and we'll be marketing them widely to others who are interested in caregiving and respite research. Next slide, please. And this is my last one. I'll wrap up quickly. Many of you are also familiar with our Innovative and Exemplary Respite Services Initiative. And again, this is one that Susan and Cassandra lead. And for the last 5 years, we've conducted a national call for evidence-based, evidence-informed, or promising practices in respite service delivery. This year, we recognized 4 new services, and you can read about them on the ARCH website at this link. We're also going to recognize them at the National Lifespan Respite Conference in 2 weeks. So we're excited that you'll get to learn a little bit more about these models, and we'll add them to the database, the growing database of programs we have recognized as innovative and exemplary. And I have to say the criteria that they have to meet to be recognized by us is pretty stringent. So we're really looking at the best of the best in the programs that are available out there. A very exciting new project that we took this year, again, run by Cassandra and Susan. We had some funding and we awarded 4 of the innovative and exemplary programs that we've identified over the last 4 years. We did an application and selected 4 programs to conduct a 12-month evaluation of their respite service. And ARCH provided ongoing and intensive technical assistance to these 4 programs. And they're in the process right now of wrapping up their data collection, preparing a data brief, and we expect them to present their preliminary findings again at the Research Summit this fall, because it's just so wonderful to have real practical program applications when we're talking about research. It's not just academic research we're talking about real life evaluation as well, that can be useful to people to improve the services that they're already providing, but also to document for funders and others that what they're doing is worthwhile and can be replicated, we hope, by other programs across the country. And I know I've gone through this so quickly. I did also want to mention that one of the products of this Innovative and Exemplary project is a series of podcasts that Cassandra and Susan did, again, with several of the Innovative and Exemplary programs. They did in-depth interviews with the program directors to learn more about what was it about their programs that truly make them innovative and exemplary. And I urge you to, if you have time, when you're jogging or doing housework, that you put your earbuds on and listen to some of these podcasts, because they're really worth your time. And I know I've gone over my time, even though I've told you all you're not allowed to do that, so I apologize. But if you have any questions or comments about any of this, please, we can take 1 or 2 questions, or I can respond to them in the chat. Do we have any questions at all? I also wanted you to know too, that if you're brand new to the program and you'd like to take some time just with me on a one-on-one, I'm happy to go over with you the background on lifespan respite, show you how to access materials on the Arch website, whatever you need. I'm available to meet with you individually as well if you're interested in learning more about what we offer and what we provide. Okay, I think we can move right on into what everybody's been waiting for, the next round of Bring, Brag, and Borrow. Again, for Bring, Brag, and Borrow, you're all very familiar with it. For those of you who are new to it, we give each lifespan respite grantee or coalition a chance to share a grant activity or a coalition activity from the past year. We've asked each presenter not to exceed 5 minutes. I know that's really hard, but we have a lot of presenters today, so I really urge you to try to stick to the time. And I'm trying to tell myself that too, to stop talking so we can move on. But this approach is really meant to give all of you a chance to show off, a significant accomplishment, and again, encourage you to follow up with your colleagues. If you hear something that you might want to replicate in your own state, or you want to share a similar experience, or you want to learn more about it, you can find, again, all the PowerPoint presentations, video links, or shared documents that they're going to talk about today on the Arch website at the link that will be in the chat as well. And we can, we'll proceed according to the schedule that you see on the slide. Again, we tried to group presentations by a topic. So today, the 2 topics in this first session, we have 2 sessions today. The first one from 1:30 to 2:30 are in culturally competent respite services and engagement strategies, and also on engaging new partners and ensuring sustainability. Again, you can follow along with the Bring, Brag, and Borrow schedule that was sent to you. Marcia, again, if you don't have ready access to it, she'll put the link in the chat. And just a reminder that Marcia will be sharing the slides from her screen, so please let her know when you want her to advance to the next slide. So we'll bring our first presentation is Megan Schwam from Tennessee on culturally competent respite services.
All right, thanks, Jill. I am Megan Schwam, the Executive Director of the Tennessee Caregiver Coalition. And I'm just waiting for my PowerPoint. There we go. All right, so I am going to talk about our outreach initiatives that are focused on outreach to marginalized communities. When I moved to Tennessee, I moved here from Iowa, and I have a 13-year-old with autism and was looking for respite services. This was before I was working at the Caregiver Coalition, and took 9 months of asking people, where do you get respite in this state, to find the Tennessee Caregiver Coalition. So one of my main focuses when I started working here was I want everyone in the state who needs respite to know about what we do. And I know that as a person with all sorts of white privilege and academic privilege and class privilege, it was really hard for me to find services. So I know that it is even harder for marginalized folks to find our services. And so our outreach efforts have focused on outreach to marginalized communities. And so today I'm going to talk about, first I'll talk real quickly about the 2 initiatives that we've done, and then our key principles for how we conduct that outreach. And so the first initiative that we started was in July of 2021. We were able to add a full-time outreach manager position. We got funding from the Tennessee Department of Mental Health and Substance Abuse to add this position. And this position focuses specifically on BIPOC communities. It is, like I said, full-time. The main focus in this position, many of you have met Breon Dixon, our outreach manager. If you haven't, I hope you'll be at the conference and get a chance to meet him. He is incredible. His main focus in this position is really focusing on Black communities across the state. And then one of the service gaps that we knew that we were missing was Latinx and immigrant communities. And so with this newest round of lifespan funding, we were able to add a part-time bilingual respite coordinator position. And so starting in September of this year, we were able to hire RJ Robles with funding from ACL, and he focuses specifically on Latinx and immigrant communities. He works 15 hours a week. He does at least, at a minimum, 3 outreach events per month focused on Latinx communities, and carries a caseload of 20, at least 20 Spanish-speaking caregivers. Next slide, please. And so we know that there is apprehension in marginalized communities about getting services. And so our focus has really been on building trust. This is a complex and ongoing process that really requires genuine effort, empathy, and respect. We did extensive research and also gathered some anecdotal data to really build on the previous work that we've done and to develop these key concepts. And so today we have 9 key principles for this outreach work. I'm going to focus mainly on key concept number 1, which is hiring diverse staff with authentic representation. The reason I'm going to focus on this is because I do think that it is one of the major growth areas in our field. You know, when I sit in these meetings or when I sit at the ARCH conference and I look around the room, I see most faces look similar to mine, middle-aged white women. And so I know that as a profession, we're really failing when it comes to hiring diverse staff. And so, but this is very much a key principle for the work that we're doing. It is really important to have authentic representation. It's very important to ensure that staff members conducting outreach activities authentically represent the communities they're engaging with, and not in a way that is tokenism, but that we're authentically prioritizing individuals who genuinely understand the experiences, cultures, and challenges of marginalized communities. I don't believe that folks like me, white women, are equipped to do this. If we're going to build trust with marginalized communities, we need folks that are representative of those communities. The next piece of this is really having a community insider perspective, which means prioritizing hiring individuals from within those targeted communities who possess an insider perspective. Those lived experiences and that deep understanding of community dynamics works to foster trust and rapport, and helps with effective communication. And then the other piece of this is really empowerment and leadership. We need to empower staff members from marginalized communities by providing lots of opportunities for leadership and professional development. So we can't just hire folks from marginalized communities. We need to make sure that there are folks of color in leadership roles of our agencies. And we need to really foster inclusive work environments where their voices are valued, respected, and given space to influence decision-making processes. Again, it can't be like a tokenization and we just hire one person of color who, is our token person of color on our staff. It really needs to be an intentional process. You can go to the next slide, please, Marcia. And so these are our other key principles when it comes to outreach to marginalized communities. The first here, which is actually our second principle, is listening to understand. So actively listening to voices and experiences of members of marginalized communities. We also need to seek to understand unique challenges, concerns, and perspectives, and being open to feedback, criticism, and learning from lived experiences of folks of color. The next key principle here is educating yourself. So taking the initiative to educate yourself about the history, culture, and issues that affect marginalized communities. And also recognizing and challenging your own biases and prejudices. If we're not doing the work to examine our own biases, we won't be able to create workplaces that are inclusive and accepting. And then also understanding systemic and structural barriers that folks of color, marginalized communities experience. The next key principle is engaging and collaborating. So involving marginalized communities in decision-making processes. You may have heard the term "not about us, without us." And so, I hear a lot of talk among folks doing respite work about how we need to do a better job of reaching marginalized communities. But often what I see is that it's white folks having those conversations and folks of color not being involved in those decision-making processes. And that, that concept of not about us, without us, is it's important to have those voices at the table and involved in all that decision-making. In addition, with regards to engaging and collaborating, really fostering partnerships and collaborations with community leaders, organizations, and other representatives of marginalized communities, and then valuing their expertise, their insights, and contributions. The next key principle is respecting and empowering. So treating individuals from marginalized communities with respect and dignity, recognizing and affirming their identities, experiences, and knowledge, and empowering community members by providing opportunities for leadership and self-advocacy. And then transparency and accountability. So being transparent about your intentions, your actions, and decision-making processes. It's also important to take responsibility for any mistakes, missteps, or harm caused. And then implementing mechanisms for accountability and feedback, making sure that there are opportunities to give feedback about how things are going. We in our staff do this weekly at our staff meetings. I ask the question, what are we doing that might make someone not feel included? And that, we're asking that question about our staff, but also the work that we're doing in the community as well. The next key principle is consistency and long-term commitment. So one of the things we know is that building trust takes time and consistent effort, and that relates to the work we're doing in the community, but also like building trust with diverse staff members. It's going to take showing up again and again and again and proving, reliability and effort. Also demonstrating a long-term commitment to addressing systemic issues and advocating for change. I think one of the only ways you can build trust is by really working to address systemic issues as well. So our staff read the book, Ibram Kendi's How to Be Anti-Racist, and really have spent a lot of time thinking about our internal policies and how we can ensure that those policies are anti-racist, and also, doing work in the community to address systemic issues and try to create change within our community. And then another piece of this is really just avoiding tokenism or one-time engagements that may be perceived as insincere. So those, like one-off showing up for something is not going to build trust. It takes really showing up again and again and again. The next key principle is prioritizing diversity and inclusion. So embracing diversity within your organization and ensuring representation at all levels. Again, making sure that there are folks of color in leadership positions within your agency is super important. Creating inclusive spaces that are that value and accommodate the needs of marginalized communities. So I think really doing some purposeful work within your agency to make sure that it is an inclusive space and that you're accommodating the needs of marginalized folks, and actively seeking diverse perspectives and voices in decision making. And then finally, the last key principle that we have is to take action and support. So back up your words with tangible actions that address the needs and concerns of marginalized communities. I hear a lot about agencies really wanting to reach out to folks of color and marginalized communities, but it needs to be more than just words. There really needs to be some tangible actions. Part of the way that we do that is by supporting initiatives, policies, and programs that promote equity, inclusion, and justice. And then also allocating resources, funding, and support to initiatives that are led by marginalized communities. So like I said, building trust is obviously an ongoing process. It requires humility, patience, and a commitment to continuous learning and improvement. These are just, our agency's key principles and the ones that we've used to do the work that we're doing and to build our outreach program. And so I'm happy to take any questions at the end, but that is all I have for you today. Thank you.
Thank you very much, Megan. Some thought-provoking information. Thank you for sharing that. Next, we have Sarah Taves from the Idaho Caregiver Alliance.
Thank you, Jill, and thanks, Megan, for setting that table. I think you've really outlined some really important key principles. I'm going to start my timer here because as I think we're all very passionate about our work and I want to try to honor the schedule. So Sarah Taves with the Idaho Family Caregiver Alliance. Our alliance is housed under the umbrella of the Boise State University. And with that umbrella, we have had the wonderful resource of being able to engage students in our work as employees, as supporters, as outreach professionals, which has really helped us extend the work that we do through the Caregiver Alliance. We have active relationships with our School of Public and Population Health, as well as with our social work program. So for all of you on this call, any opportunity you have to engage with academics and the students in those programs, I really encourage us to capitalize on that work. What I have to share with you today is an ongoing project that touches on two national goals from the national priorities, one around research and one specifically to outreach and engagement of members of the underserved communities, and in our case specifically with Hispanic family caregivers. So this work began in May of 2022. Adrian Rodriguez, who is a member of our staff, who has been co-supported financially through the Lifespan Respite Grant, as well as through our grant through the Idaho Division of Medicaid and their Money Follows Persons initiative. We launched our Family Caregiver Navigator program in September of 2020. And, you know, with the grandiose idea that we would be attracting caregivers from across the spectrum. And what we found in our early evaluation of that work is that we weren't really engaging members of the Spanish-speaking community in the Family Caregiver Navigator program. Now, this was during the pandemic, and so our whole program went virtual, and we were doing telephonic support through using the TCare platform. And it really caused us concern that we were not reaching a very important sector of the population here in Idaho. And so that caused us to step back to think of, well, what are some, you know, why not? What are we missing in this outreach and engagement of members of the Spanish-speaking community? And so with that, we established the Hispanic Family Caregiver, or the Hispanic Advisory Group, that works through the Family Caregiver Navigator as well as the Idaho Caregiver Alliance. And I think this really speaks to Megan's point about, you know, being authentic, capturing the voice of the community, listening, learning, not a one-off, but an ongoing. And so the Hispanic Advisory Group meets quarterly, and they have been guiding us through our evolution of the work that we've been doing through the Caregiver Alliance, as well as the Family Caregiver Navigator. We tapped the expertise of a student, Adrian, and specifically, to really help us look at the literature. And the research I'm presenting here is really two phases. One, we looked at the literature to really explore the cultural norms within the Spanish-speaking community and how those might be affecting engagement and participation. And then the second phase, using that knowledge, Adrian interviewed public health professionals across the country who've been actively working with members of the Spanish-speaking community to identify from the professional's perspective, what do they think are the strengths and weaknesses of the programs they offer in engaging members of the Spanish-speaking community. So that's a little bit of background. The publication that's come out of this work has been accepted in the Journal of Latinx Psychology. It is open source. And so encourage you to look to that literature as in your future program planning and implementation. I'll let you go to the next slide, please. So this is what, from the literature, Adrian really exposed or brought to fruition, is this importance of cultural norms within the Spanish-speaking community, of personal miso, you know, the importance of family, the importance of the Virgin Mary and, you know, guiding religious faith as a guiding principle in the work you do, the importance of the male figure within a Hispanic family and engaging them, the importance of dignity and the importance of respect. Again, that, you know, their routes of communicating and engaging may be very different from us. In one of our recent conversations we've had through our engagement with the advisory group is, oops, and I realize I'm just about out of time here, is, you know, we were talking about outreach to members of the Hispanic community, and they were referring to the bright pink buses that are for mammography testing. And that, you know, for a member of the Spanish-speaking community to think about going into a bright pink bus to do something so personal as doing a breast exam may not really be culturally appropriate because of all of these different perspectives, which was like, oh my gosh, we're so blind in so many ways. But so we've been using this literature and these findings to communicate this to healthcare providers in Idaho, to community partners, to the Division of Medicaid, Division of Public Health, to really help highlight the importance of reaching people where they are and through their cultural norm. I'll let you go to the next slide, please. So some of the recommendations that came out of the interviews with public health professionals are really very similar to, I think, what Megan shared as well, is, you know, we need to educate ourselves. We need to make sure we're being culturally sensitive. We need to be culturally competent. And we need to address not only the needs that our program may provide, but the social determinants of health needs that a population may experience, such as transportation services, so that we're really meeting them where we've
Sarah, you've frozen up a little bit. We may have lost her. Am I the only one?
No, she's definitely frozen.
Oh, that's so sad. We may have to come back to her.
I've posted the link to what she has hyperlinked in her slide called application. It's actually a flyer for the 2024 Hispanic Family Caregiver Conference. So be sure and check that out if that's of interest.
I'm also about to post a presentation that the Idaho Caregiver Alliance has done on a lot of this work that she's talking about. So if you want to go into more depth, she presented at one of the National Strategy Learning Collaborative, so I'll post that too. Okay, I think we should move on to Rachel from the Respite Care Association of Wisconsin. Thank you, Rachel.
Hi, thank you for having me, and thank you so much to Sarah and Megan for everything you do in your states. I really enjoyed listening about both of your initiatives. We can go to the first slide. Thank you. Something that RCAW launched was a grant specifically for the tribal nations of Wisconsin. It was specifically for direct respite care. We wanted this grant program to be completely self-directed and at the discretion of the tribal unit directors, because as white women, we don't know the needs of the tribes like they do. Even before the national strategy came out in 22, RCAW was finding it challenging to build lasting relationships with tribes, and we have learned so much since we have launched this grant. Making connections and understanding the needs of Native American caregivers is key. We understand that not all tribes are the same, and I encourage everyone on this call to definitely learn about Native tribal nations in your state. You will learn so much. You will find individuals that will sit down and tell you about their different cultures, their different needs. We've learned that there has been a hindrance to culturally appropriate caregivers, and how Native Americans, I don't want to speak for all of them, but a lot of them are not comfortable with non-natives coming into their home to care for their loved ones. So the objective of this project was to increase the likelihood of Native American primary caregivers assessing respite care when they can self-direct the provider of their choice. And ultimately, we wanted connection and trust to be built with their communities in our organization. Next slide. Thank you. So initially, we met with the Great Lakes Intertribal Council, or GLITC, if you're familiar with that acronym. We wanted input on even the verbiage used on the flyer for the info session. The objective for the informational session was to gather with the tribal unit directors and see the needs of their communities. We wanted to know what dates and times worked best for them. We wanted to make another attempt. I think it was Megan who said it's not a one-stop shop. You just make a connection one time, you keep showing up. So we wanted to even tailor the info sessions multiple if they needed, on days and times that worked for them. This is where we learned about potential barriers for tribes applying. 6 of the 11 came to the info session. Others emailed us, and which was right there as a way that started a relationship and got us closer to building an even more meaningful relationship that we ever had before in years of trying to reach out. That some tribes have too much money, depending on where potentially, we learned this, that the Potawatomi tribe, they have a casino in an urban area. And because of that, that tribe has a lot more money than other tribes. And we learned which tribes have a lot less money and more poverty. And so with that being said, we also learned that there's a shortage in tribal aging units, and that the directors are making meals, serving meals, delivering meals, and doing things outside of the scope of their job. But what that allowed us to do was to do more outreach in their community and learn about grant programs that natives in their tribes could apply directly through us to build that trust. We needed that pass through from the aging unit director that individuals in their communities knew and trusted to hand us off to them. Next slide. Only 2 tribes applied for this. And something I wanted to point out that you might think, okay, why are you, bringing this to a bring, brag, and borrow if 2 of the 11 tribes applied for this grant? We learned so much invaluable information. We are gathering information on the tribes, exactly what they need for direct respite care. Some tribes don't want to hire family. Well, I don't want to speak for everyone in the tribe, but when we meet with the aging directors, some of them state that they would rather have people from an agency come into their home versus other people from their families, depending on different dynamics. We just ran a report 2 weeks ago, and the individuals from different tribes are coming to the Respite Summit. That's never happened in my almost 6 years with RCAW, and we host an annual summit. And it serves as the basis for establishing and strengthening the relationships. And that is the biggest brag that we have with this project. So this really helped identify an opportunity to explore how to better serve tribal communities in Wisconsin. And we're excited to share that information once we can gather it and disseminate it. And that is all I have.
Thank you very much, Rachel. I think sometimes learning from what didn't go well is just as important as learning from what did. So thank you for being willing to share that.
Absolutely.
I think Sarah might be back on.
Oh, good.
We feel very badly, Sarah, that you froze up. Are you back with us?
Yes, I am. Yeah.
Do you want to take one more second just to finish up your presentation? Everybody was very engaged in what you were saying. We were sad.
Oh, thank you. I think the last thing I wanted to share was just to have folks recognize how we've applied what we learned, and that was through the in-person caregiver conference for members of the Spanish-speaking community. And we doubled our attendance this year. Last year, we had done a shared linkages through Zoom with the virtual caregiver conference, and that did not work well. So this year, the conference for the members of the Spanish-speaking community, it was all done in Spanish with bilingual presenters. All of the resource tables were bilingual. We had respite provided for the children or folks that they care for. So really worked to apply what we learned through the research and interviews. And it was an incredibly successful event. And we continue to engage our Spanish-speaking advisory committee to help guide us in next steps in this work. So thank you very much, Jill, for letting me chime back in.
Absolutely. Okay, we can go to our next slide. We have the next topic is engaging new partners and ensuring sustainability. And our first presenter is Sarah Schmidt. And I know I did not set a very good example, but if we could remember to try to stay to our 5 minutes, that would be greatly appreciated.
Thanks, Jill. So my name is Sarah Schmidt. I'm the Deputy Director for the Arkansas Department of Human Services, Division of Provider Services and Quality Assurance. That's a mouthful, so we like to call ourselves DIPSQA here at DHS. And I am proud to have on the phone with me today our director for DIPSQA, Martina Smith. She is actually going to be attending the Respite conference for the first time this year. So I know she's looking forward to that. You can go ahead and go to the next slide. So in Arkansas, over the past several years, we've really been trying to focus on just our respite services and getting those out to the caregivers and how we can provide that. In the past, we've often just subgranted out most of our voucher funding to other organizations. But what we learned with that is while we were getting funding out, we weren't capturing all of the age ranges or the disability needs across the state. And there were several spots within the state that we couldn't find anyone to take on the grant for us. So in 2022, we decided to launch an in-house respite voucher program within DHS and within our division. We set that up with $300 vouchers that caregivers can apply for every quarter. This would allow them to get about $1,200 in respite funding each year through this. And as of I would say of April, we have provided over 350 of those vouchers to over 182 caregivers. We have about 75 counties within the state, and I believe we have captured almost all of them at this point. So that was really exciting for us. Last month, we actually took our application, which is paper-based. People go on, they print it out, and they either email it to us or mail it in, but we have taken that application and now turned it into an online application that they can fill out electronically. We've also implemented kind of a variated application for those caregivers who have already applied and received vouchers from us. One of the things we learned when we do feedback after providing our vouchers to caregivers is that some of these caregivers who are like clockwork, every quarter they will sit in their application with saying my information never changes and I'm filling out the same application over and over again. So we did take that to heart and kind of built a different application for them so that they could fill out anything that may have changed for them, but then to save the information they had provided us previously. We also have our paper applications in Spanish and in Marshallese, which is also a big community here in our state. And we hope to get those on our electronic format as well really soon. In 2023, outside of our Lifespan Respite Grant, we've been partnering with the Alzheimer's Association and Alzheimer's Arkansas, which is a nonprofit here, to look at providing funding for dementia and Alzheimer's. We've done that for several years through the Respite Grant, but a couple of years ago, DHS partnered with them, and we have began awarding funding through our social services block grant within DHS to the Alzheimer's community for a respite and a dementia and Alzheimer's voucher program specifically. So the way that we have set that up is that any referrals or any respite inquiries we get through our in-house vouchers for anyone that cares for dementia or Alzheimer's, we refer them over to our Alzheimer's Arkansas partners so that they can keep data on that information, provide them respite vouchers. And then if they run out of funding, which they have every year since we've given it to them, which I find is a good thing, then we will actually take those voucher inquiries back in-house and provide that supplemental funding through the Lifespan Respite vouchers. One of the things that we learned when we were doing vouchers in-house is that we had several caregivers asking if they could kind of bundle their $300 vouchers into several quarters and maybe just wait out the whole year to request again because they wanted to use that funding for respite camps, and the $300 wasn't enough. We actually just recently partnered with a program here in the state called Camp Aldersgate that do respite grants and respite camps to do scholarships with them for this purpose. So if you go ahead and go to the next slide. So this is fairly new. We're actually still working on this with them, but Camp Aldersgate is our only camp within Arkansas that is accredited by ACA to serve individuals with special needs. They have been doing this for several decades now and have a lot of experience in how to do that, and their staff set up for that kind of thing. So one of the things that they do in their camps are they provide different camps for different age ranges and different disability types. But they do the traditional camp activities, arts and crafts, nature lessons, and different things like that, while also having that component of helping with their basic needs or teaching them other life skills. The weekend camps actually range from anywhere from $100 to close to $500, depending on a family income level. And then the summer camps, which are usually a week-long camp or so, can get all the way up to $700 or $800. So what we've done is we have worked with Camp Aldersgate to look at starting a scholarship program for those caregivers who may not be able to fund out of pocket these respite camps. We have already provided them a $10,000 sub-grant, and I am proud to say they blew through that pretty quick, which means that the need is there. We are working right now to process another $40,000 for them to continue that, especially through our summer months that are coming up, and then hopefully using that as a baseline to then kind of build that program out with them a little bit more. And to save on time, I think that's all I had.
Thank you very much, Sarah. We can now move on to Tammy Foster from Illinois.
Hello. Good afternoon. Thank you to everybody for sharing. I love hearing everyone's passion for their agencies and what their agencies are doing. You can go to my first slide, please. My name's Tammy Foster. I'm approaching my first year working for the Illinois Respite Coalition, and I'm glad I get to share our approximate 5 minutes of bragging rights. So, first, I'd like to talk about our the implementation of our Respite Task Force, which was no small undertaking and over a year-long process of getting this up and going. This started with caregiver survey, so we could focus on caregiver needs, and we wanted the task force to be represented by a variety of those working with caregivers and as caregivers, so that we could get the best goals possible to work forward with for supporting all the caregivers in Illinois. This is a joint effort with our lead agency, DHS and DDD partnership with Meg Cooch. We currently have 21 members on this task force. And these, like I said, a variety of agencies and organizations, including the Caregiver Coalition, DCFS, DOORS, IDOA. We also have parents and caregivers and schools in the Arc of Illinois, a lot of agencies and folks involved in this. Our first meeting was in December, where Jill was so nice to present and kick off discussions with the national strategies. In March, we met again, And the goals were chosen to focus there, the increased awareness of and outreach to family caregivers, to strengthen services and supports, and to expand the data research and evidence-based practices to support family caregivers. We're meeting on a quarterly basis, and now that we have committees, those committees are meeting in between those quarterly meetings. And I'm happy to say that those committees met and are meeting this week. One committee met on Monday, another on Tuesday, and I think the other committee meets tomorrow. So excited to see how those meetings move forward. Our next quarterly meeting is in June. And the goals of this task force is to, establish those strategies so we can continue to care for caregivers the best that we can. And go ahead to our next slide, please. The next area I would like to brag on a little bit is our respite provider training. And this was part of a pilot project. And I know New Mexico mentioned a little bit about this yesterday. We provide this Illinois specific training now after our, this was our first fiscal year to do our post-pilot. We have approximately 100 individuals have completed the training with several more in progress. This is done at the caregivers, the provider training is done at your own pace. It's all done online. And we're just really hoping that this is going to be an opening to creating a directory for families to be able to find caregivers due to the shortage of direct care workers across the state. Part of this outreach for this is helping us create community involvement in these rural communities and those underserved so that they can get more community support. And we're excited to continue this. And if you have completed our provider training, be watching for an email in the next coming weeks as we reach out for you to create your own profile for families to be able to see. And I think that's all that I have.
Thank you very much, Tammy. We'll move on to Lisa from Massachusetts.
Hi, everyone. My name is Lisa Marschke, and I'm so delighted to talk about the Massachusetts Lifespan Respite Coalition and what we have been up to recently. Massachusetts has had a lifespan grant for quite some time, and we're really excited during this cycle to be working with the University of Massachusetts Amherst on a campus to community program, which we presented on at the last year's Bring, Brag, Borrow. But this year, what I want to talk about is something that's new here in Massachusetts. And you can go on to the next slide, please. Here in the state of Massachusetts, the Executive Office of Health and Human Services awarded 40 organizations $18 million to implement innovative approaches to provide respite across the state of Massachusetts. And as you can imagine, our Massachusetts Lifespan Respite Coalition membership was very, very excited, and there was a lot of energy and enthusiasm about how we could learn about what these innovation grantees were doing that was innovative, and how we could potentially work together. So we're in the process of doing that this year, which we're so excited about. So what we've learned so far is that the grantees are providing respite in a variety of different ways, not the least of which are holistic respite programs, caregiver to caregiver programs, destination respite, lifelong learning respite, staycation respite, and there are others. And also what we're learning is that the types of caregivers that are supported by these grants also cover sort of a wide range, not the least of which are caregivers of those who are older, caregivers for children with complex medical needs, and those with behavioral health and substance abuse needs. We have invited all of the grantees to participate in our quarterly MLRC meetings. We have had 2 meetings so far, and what I'll do next. So the respite grantees were really interested to join our meetings because they look to the MLRC as sort of those that have been doing this work for quite some time. And they were really interested to talk with us and gain some additional knowledge around how to provide respite. And so we're really, really happy to do that. So if you go to the next slide, the first time we got together was in January. And one of the first things that we were trying to figure out is how do we sort of work together? What is the commonality that brings us together? So we spent a lot of time in January. And then for our April meeting, we decided to get together on these 3 different focus groups. So we created 3 breakout groups for us to participate in. The first was for respite programs that serve caregivers of children with those with complex medical needs. The second was around serving caregivers of older adults. And the third was around those respite programs that support diverse caregivers. So luckily, those folks that attended the April meeting, these groups were very evenly distributed, which was really nice. We didn't plan for that to happen, but it did, which was awesome because it wasn't, tipped in one direction or the other, which is terrific. And when we asked these groups to get together, the 3 bullets are what we gave to the facilitators to sort of help inspire the conversation in the 45 minutes that folks were together. So it was, I see this new trend. Is anyone else experiencing this? I have this problem. Is anyone else having this problem? Or there's something that happened that I'm really proud of, and I'd like to tell you and share with you all of those great things that occurred. And I will say, one of the things that we quickly learned, if I go back to just the top part of this slide for just a second, is that we realized very, very quickly that separating respite programs that support diverse caregivers was not the step to take, and that really the diversity conversation needs to happen no matter what population we're working with. So we very quickly uncovered that and are looking forward to our June meeting where diversity is sort of going to be weaved throughout. And I'm really inspired by the information that has been shared earlier today at this Bring, Brag, Borrow. Jill, I don't know how you say that so fast. Session today. So we're excited to get together with our respite grantees, and we already have a flavor of Bring, Brag, Borrow that will be happening at our June meeting. We've got a few grantees that have volunteered to share their innovative approaches with us. So we're really excited to learn from them and share any expertise that we can. So thank you so much for your time. And I hope I see a lot of you in Albany coming up soon. Thank you.
Thank you, Lisa. Great things happening in Massachusetts. Very
Yeah.
exciting.
Yeah.
We have our last presenter for this session, Frederick Wilson from South Carolina.
Thank you, Jill. My name is Frederick Wilson. I serve as the Executive Director of the South Carolina Respite Coalition. This week is actually my 1-year anniversary with the coalition, and I'm really excited about attending the national conference in 2 weeks. I am peacock proud and hippopotamously happy to share how South Carolina is using regional respite advisory councils to further outreach, engagement, and collaboration with family caregivers and community partners. In South Carolina, we have a wonderful partnership between the South Carolina Respite Coalition and the South Carolina Department on Aging as we engage family caregivers and community partners statewide. Next slide. Our regional advisory councils are engaging our beautiful and diverse state. As you can see, we have a map of the state of South Carolina, And our 4 regional respite advisory councils are highlighted. We have advisory councils representing the upstate, the beautiful mountains of the upstate, the Midlands region, the beautiful sand hills of the Midlands, the PD with its beautiful agriculture and beach scenery, and the Low Country with the historic tourist sites such as Charleston and Hilton Head. Our state is beautiful and diverse, and we established regional advisory councils, which really consist of regional staff of state agencies, area agencies on aging, respite providers, caregiving organizations, faith communities, and other local entities. And really the purpose of these regional respite advisory councils are to provide localized insight into the needs and available services related to respite and family caregivers. We also serve as local dissemination points for lifespan respite information and resources across the state of South Carolina and our various regions. Like most states, again, as I mentioned earlier, South Carolina has a unique makeup where demographics, needs, and services vary widely depending on the area. Next slide. And we're really excited about how these regional respite advisory councils are furthering outreach, engagement, and collaboration across the state. It's yielding tremendous benefits, community partner benefits, where we are seeing increased collaboration with other agencies and state service providers in the areas. Increased collaboration between the AAAs and Lifespan, which is really exciting. There are family caregiver benefits where there's access to local, regional, and statewide information that can assist them with respite and other services. Also, attending a local event is much more feasible than attending an event centralized in the state. Each of the regional respite advisory councils will sponsor a respite resource fair. This year, the councils are being mobilized to plan and implement a regional respite resource fair event during National Family Caregiver Month in November. And we're really excited about it. And all of the councils are working really hard to prepare for November. And really the genius of this event is to jumpstart Respite Awareness Day for February 2025. These regional events in November will create tremendous momentum for attendance and participation at South Carolina Respite Awareness Day at the State House in Columbia, South Carolina in February 2025. We're really excited about the regional councils and how these entities are helping us to further outreach, engagement, and collaboration in the Palmetto State. Thank you, and I look forward to meeting all of you in person in a few weeks.
Thank you so much, Frederick. I love this whole new regional council engagement across the state. It's fantastic to hear about that. Thank you all for really wonderful presentations today. Again, overwhelmingly wonderful. So we're very grateful, and we're almost nearly on time. Can you bring up the next slide, Marcia, please? Thank you. Before we all step off for your break, I first of all want to acknowledge and let you know that both Lori and Emily are with us again today, our dedicated federal project officers who have taken time from their very busy schedules because they just love hearing about everything that you're doing. So I wanted to just thank them again for being with us today. Before you all step off for your break, we would appreciate it if you just took a moment to respond to this question in the chat. if you have your dream hat on and if resources were not an issue, what is one improvement you would like to make to your lifespan respite care program? I think that we're about 5 minutes behind, but I think we'll still take our 15-minute break and we'll be back here at 2:50. 10 minutes to 3. We'll get started promptly with the next bring and brag and borrow session. So thank you, everyone. Great morning and great afternoon so far. We'll move right into our next bring, brag, and borrow session. I hope you all had a good break. We have some wonderful topics this afternoon. I'm kind of sad that this is our last session, but I'm looking forward to it tremendously. We're going to cover the topics on raising public awareness and engaging caregivers. And then we'll have our final presenter is going to share several highlights from their current lifespan respite grant activities. So I couldn't quite fit them into a topical area. They're covering several topics. But let's start. We'll move to our first speaker with Abby Darapentini from the New York State Office for the Aging on raising public awareness and engaging caregivers. Abby, the
Thanks,
floor is
Jill.
yours.
Hi, everyone. As Jill mentioned, my name is Abby Darapentini. I'm with the New York State Office for the Aging. I help to oversee the Lifespan Respite Grant, the National Family Caregiver Support Program that's managed by New York's 59 AAAs, and we also have 17 state-funded caregiver resource centers. I am representing our New York State team today, but would be remiss if I didn't mention my colleagues Dina, Caitlin, and Amber, who work with me at the state office, and Doris Green, the director of the New York State Caregiving and Respite Coalition, and the rest of her team. So today I'm going to share about our current efforts to improve access to respite statewide through the use of the Life Course Tools for Respite. This project also aligns with Goal 2 of the National Strategy to Support Family Caregivers, which is advancing partnerships and engagement with family caregivers. You can go to the next slide, please. So many of you may be familiar with the Charting the Life Course framework, which was originally created by the University of Missouri to help individuals of all abilities develop a vision for a good life and identify supports and discover what it takes to live the lives they want to live. The university, in partnership with Arch, developed tools specifically designed to be used with caregivers to help them identify the need and the benefits of respite care. And I know we all know the importance of incorporating respite into the lives of caregivers, but these tools allow the caregiver to plan for incorporating respite into their lives and allows the respite to be customized to meet the unique needs of family caregivers. So you can see on this slide, we do have one of the tools. This is the Integrated Support Star. The STAR is meant to help caregivers think about their own life and the supports and resources that are available in each category that could help make respite possible or improve the respite. So the following areas are covered in the STAR. There's technology supports, community-based resources, eligibility supports, relationships, and personal strengths. You can go to the next slide. And I know that these, the tools that are on the slide are really small, but I did put the link on this last slide. So if you want to look at them a little more in depth. But in our grant proposal, we identified that implementing the Life Course tools would be a great way to partner with the Aging and Disability Resource Center, known in New York as New York Connects. The New York Connect staff are housed at our local offices for aging and independent living centers across the state, and they are trained as person-centered counselors. So we thought these tools would be a great addition to the things that the staff already use when working with families. And then after writing our grant proposal, we also identified that it'd be helpful for the caregiver support program staff to be familiar with these tools as well. So our goal is to train the New York Connects person-centered counselors and the caregiver support program staff at our AAAs and ILCs over the final 2 years of the grant, so starting this July. So to prepare the staff at our office, the person-centered counseling trainers and the caregiver support program, we worked directly with the University of Missouri to prepare for training our network. So last year, we participated in the Ambassador Series, and this consisted of 5 online modules and related learning activities on each of the respite tools. So through this series, we were able to become familiar with the key principles of the life course tools. And then what we learned in the video modules and the learning activities were then reinforced. We had 5 coaching calls with staff from the University of Missouri that really provided follow-up discussions on the principles that were practiced during the videos. And then some of our team also participated in a skill building series. So the university offered us some hours of technical assistance. So we did that through a skill building series where they observed the university staff training individuals from another state on the use of the life course tool. So how to actually do a training for staff. So the university is going to be providing us with a facilitator guide, which we will use when we're training the staff in New York. And we are hoping to hold our first training over the next few months. So we are anxious to see how it goes. We are planning to provide online learning modules through a platform that's being developed with the Center for Aging and Disability Research Education, which is out of Boston University. So our office used some ARPA funds to build this training platform for person-centered counseling training for the New York Connect staff. So we're going to kind of tap into that and put this training on there as well. So we're also going to incorporate live training to then be able to practice the skills that are learned in those online modules. We are still deciding if that live training will be held in person or virtually. We might do a combination of both. And then lastly, you can see on the slide another one of the tools. This is called the trajectory. And this one helps caregivers reflect on their past experiences to know what to build upon and the vision for what the family unit does and does not want for respite care. So like I said, I've also included the link to the Life Course Tools for Respite website if you're interested in learning more. That is all I have, but we are so excited to see you all in New York in just a few short weeks. Thank you.
And I have to thank Abby and her team also for co-hosting our conference, which would not have been possible without their help and support. So thank you on many levels, Abby. Our next presenter is Tracy Sinowitz from Alabama.
Hi, everyone. As you'll see, my slide is blank. It's because I'm going to show you a video in just a few very soon. But first, I want to tell you a little bit about it. In an effort to increase awareness of and outreach to family caregivers, we went through a public service announcement initiative last year. So Alabama Lifespan Respite was awarded marketing assistance from the American Advertising Federation's North Alabama chapter through its annual public service project. And it's to help nonprofits reach marketing and advertising goals. So as a result, 3 professional Alabama Lifespan Respite public service announcement videos have been produced featuring our caregivers and their testimonials to help individuals identify as caregivers, to raise awareness of the importance of respite, and to direct caregivers to Alabama Lifespan Respite for resources and assistance. We asked for 1 video and we got 3, and it was an amazing process. And all production and related costs were donated for this project, and it totaled about $25,000 in kind from the 4 collaborative partners who worked on this project. The first of the 3 videos is Carla's story, and Carla's story features a mom caring for young twin daughters, both diagnosed with ASD. The second, Dawn's story, which we'll see today, features a husband caring for his wife with a rare autoimmune disorder. Dawn's story, I have to mention, won 2 awards this year at the 2024 American Advertising Awards. So the teams who worked on this were very proud of that. And also friendships emerged out of that one too. The caregiver Dawn became very close with some of the production guys who came out and filmed his story. So that was kind of a neat result. The third is called Valeria's Story, and it features a daughter who cared for her father with dementia until his death. And just have to mention, she's now caring for her husband, who was recently diagnosed with a terminal diagnosis. And so she's enrolled with us for a second time. And so these are all caregivers we know and we love and work with. And we're so glad to be able to feature their stories. So the way we're sharing these PSAs, we're partnering with the Alabama Department of Rehabilitation Services children's rehabilitation services in their clinic lobbies statewide, where they have those televisions set up in the lobbies, as well as online and via social media. And we want to go to where the caregivers are and have this information in front of them to help them identify again as a caregiver and connect them to us. The Alabama Lifespan Respite Coalition, agency and community partners, and healthcare providers statewide have also shared these PSAs as appropriate with their caregiving communities. The Alabama Department of Senior Services, Alabama Area Agency on Aging, Alabama Cares, Alabama Council on Developmental Disabilities, and the Alabama Head Injury Foundation have also shared our PSAs on their websites, social media, and through direct email campaigns. So if your agency would benefit from professional marketing assistance to raise public awareness and engage caregivers, I strongly encourage you to reach out to the American Advertising Federation or the Public Relations Society of America chapters in your state. Both of these national organizations offer these public service projects each year at the chapter level, and they just want to help us, reach marketing, advertising, and PR goals. It was a really amazing process. It was a long process, but it was really great, and I'd be glad to speak with anyone who's interested more in depth anytime if you're interested in pursuing these opportunities in your state. I'll also add the links to both of those organizations in the chat, but now I would like for us to watch Dawn's story.
Alabama Lifespan Respite has been really important to me. Never did I ever imagine I would be the one taking care of my wife. I always thought it'd be her taking care of me. My name is Don Cale. Elaine is my child bride. We went through grammar school, high school, and college together. Had a daughter and then had a son, and I moved around in the military and then ended up here in Huntsville after I got out of the Army. On Saturday before Easter, 2019, she woke me up and said, "Hey, I'm losing feeling out of my fingers. I can't, the feeling is leaving." Thought it was a stroke and did some tests and came back, and the doctor got me and said, "I'm pretty confident based on patients I've seen before that it's Guillain-Barré syndrome. It attacks your nervous system. She can't feed herself. She can't scratch her nose. It's a horrible condition to be in. So we pretty much got to have eyes on her 24/7. I'm an old Airborne Ranger infantry guy. Beat up, broke up, never got shot up, got cut up a little bit. Until this happened, it was like I was always leaving her, deserting her. Good reason, go to war if that's a good reason. But I'm not gonna leave her now. When I was in Ranger School tries to stress you out. They starve you, they deprive you of sleep. And I remember one night, my buddy handed me a can of peanut butter. He said, "Take a swap." And there were 5 of us on this team, and somebody back there had opened up this little can of peanut butter that had maybe 2 whole tablespoons of peanut butter in it. And each one of us Ranger buddies took a swap out and did that and passed it up to the next guy. And I thought about that a lot. I don't get enough support from them to pay for my caregiver 24/7 or, 10 hours a day. But I get a little bit. I get a little bit of help. And it reminds me of that can of peanut butter. It wasn't much. But number 1, it was something. Number 2, it was somebody helping me. Well, that was the mental aspect probably was more important. Hey, my buddies are taking care of me. We ain't got much to share, but they're taking care of us. We're in this together, And that's what Alabama Respite has been for us.
And that's it. I posted the links to the 2 other videos in the chat too, if y'all are interested in seeing those. Thank you.
So moved by that, Tracy. Thank you so much for sharing that. And it's so exciting that it won an award. I can't get over that. Our next speaker, we're very fortunate to have Yetunde from the Maryland Department of Human Services.
Good afternoon, everyone. My name is Yetunde Olobatuyi, and I am presenting from Baltimore, Maryland. So I don't have a PowerPoint, but thank you for showing our Respite grants flyer. I'm going to tell you a little bit about this program. So in our program, we specialize in offering lifespan emergency respite grant to support caregivers in times of crisis. We provide up to $500 per year to help reduce unexpected expenses, enabling caregivers to address emergent situations without compromising their caregiving responsibility. So an example of this would be if there's a death in the family, if there's a civil obligation, such as the caregiver having to go to court, having to go for jury duty, if there's a sudden home repairs or damages to the home, for example, fire, if the caregiver is in the process of losing their employment, if they have to go to the hospital, we will give up to $500 grants that we receive through the ACL. So over the last year, we have been working on outreach and staffing issue. Before I joined the agency, it was during COVID. We have partnered with a third-party agency to help manage these grants. When I came on board, I realized that nothing was done. We was just paying this third-party agency pretty much for doing nothing. So I took it upon myself and we brought back the grants in-house, and we were able to allocate to all our 24 local Department of Social Services. What we did, we gave them each allocation, we gave them the same amounts of funds to use for emergency respites, whether it is the caregiver losing their home, whether they're losing their employment, people can apply and get these grants. Earlier in the presentation, I heard about 2 or 3 people talked about tornado happening in their states. If only you live in Maryland, I would have applied you to apply for our respite, emergency respite, because we will give you these grants only if you're a caregiver. So what I do want to mention is that in the history of our grants, over the last year, we have been able to serve 52% of our clients being African American, which is a big milestone in the program history. And the reason for this is because we have been going to churches, we have been going to hospitals, we have been doing a lot of outreach everywhere that African American population resides in. And that's what I have. I hope to see you all in 2 weeks.
Thank you, Yetunde. I think it sounds like amazing outreach work you're doing in the state.
Thank you.
Our next presenter, Alexis Witt from North Dakota.
Thank you, Jill. And I have to tease you a little bit. I was just MC at a symposium last month and I kept us all on time. They said, oh, the time girl is back up again. So I promise I will be under my 5 minutes. Next slide, please. Next slide. I wanted to talk about something a little unique today that hasn't been discussed yet. So I wanted to talk about a caregiver summit that we are planning through our Lifespan Coalition for this upcoming October. The theme of the summit is going to be caring for the caregiver. with the target attendees being all caregivers and all providers. So family caregivers, agency, individual, all caregivers across the lifespan. It's going to be just a one-day summit. Next slide, please. And the keys of this is that we are really just representing the lifespan. So we're going to have topics discussed such as programs and supports available for those across the lifespan. So we'll have topics such as autism, DD, my programs that I manage to benefit caregivers, which are lifespan and family caregiver. And then we're really going to have a strong focus on identifying caregivers. We have a common barrier here in North Dakota, as I'm sure there are in other states, that caregivers are just identifying as the loved one, as the mother, as the son, and not as the caregiver. So have a strong emphasis on caregiver identification tools. Really excited to have our keynote speaker is actually nationally known. She'll be presenting on communication strategies for persons with dementia. She was at a symposium last month in North Dakota, and it was really exemplary. She really challenged that the typical caregiver may say comments to the care recipient like, "Oh, don't you remember, you just took your pills already," and almost condescending and creating that negative loop that doesn't have a good relationship. So she really challenged the status quo of that and really engaged and did different communication strategies on how you should be interacting. So she is coming back and tailoring her presentation specifically for caregivers. So really, really excited about that. And also we will be having a focus on wellness for the caregivers. So we will be doing a chair yoga and possibly some other exercise presentations just on caring for the health of the caregiver. And then to wrap out the day and in the afternoon, we're going to have some panel-based discussions. So we will have a caregiver. We really want to have a focus on if there's any new caregivers there, just on an FYI on what that looks like. What does a typical day look like in the eyes of a caregiver? Also want to have both provider as well as individual and agency providers there, just to talk about the whole process, about what it looks from right when they get that first call to providing respite, what that looks like to when they actually get in the home, and then talking about what approvable activities and services that they are provided and are able to do during that respite visit. And then finally on the panel, we will also have a medical doctor, likely going to discuss criteria to diagnose dementia and to answer any other questions that anyone would have. Most importantly, with this panel discussion, we really want this to be participant and caregiver driven. What are their needs? What do they want to get out of the symposium? So really going to let them drive that, but we will have prompts to go over some of those things that I just emphasize as well, in case there's not a lot of engagement or a lot of initial questions about that. So really, really excited about this summit and looking forward to seeing you all in New York. Thank you.
Thank you very much, Alexis. That was great. Our next speaker, Aida Stevens from Oklahoma.
Hello, everyone. And those that know me know I do need a timer. So I'm going to do my best to be respectful and share the great work happening. And I have certainly enjoyed the past 2 days learning from everyone. I always love the BBBs. It's something I look forward to. So similar to the summit that was just shared, we do have a statewide Oklahoma Family Caregivers Conference. And before I dive in, I want to first give a shout out to our team that's on the call. We could not do what we do without, of course, our team as well as the partners. For those that don't know, I'm actually out of the University of Oklahoma, and I'm the director of a program called Sooner Success, but we partner daily, very interactively with, we call it CAP. It is the Community Living, Aging, and Protective Services. And it's just been the labor of love, now going on 10 years. But we just had our 6th annual Oklahoma Family Caregiver Conference, We always hold it in November. I'm not going to read each bullet point verbatim, but I want to draw your attention to these highlights. This last one we did, we took it next level. We did 5 in-person sites strategically placed across the state, as well as had the virtual stream. We also had some national speakers, Jess Rona from Unseen documentary. If you haven't seen it, check it out. Richard Louie from Unconditional. He's a MSNBC reporter. Again, phenomenal work. Do check it out. We also have great local speakers. We have resource tables. I'm going to show you some pictures next. But before we go to that, I also want to let you know we ask participants when they're registering what accommodations they need. We actually did have quite a few that needed Spanish translation. However, want to point out we ask whatever accommodation that is. If they requested another language, we would want to honor that. But we had a Spanish interpreter located at the Oklahoma City location where that request came from. We also had American Sign Language and just provide accommodations, whatever those caregivers might need. And that's exactly it. It is all about those caregivers, their health, their wellness. We had over 700 register, and we have an amazing caregiver panel. It's multi-generational, it's the siblings, it is the caregivers, it's the grandparents, and other relatives raising their loved ones. And so it is, it always takes us like next level. We're always trying to outdo the next one. And we are super excited. We've been able to access a $25,000 grant to help address barriers so that caregivers can attend. And go ahead to the next slide, please. So some of the things we've already addressed in terms of barriers are educational vouchers. So we have these exciting trainings, these events, but unfortunately caregivers aren't able to access them because they need someone to care for their loved one. So we offer what is called an educational voucher. Well, transportation is also a barrier. And so we're going to be able to offer them transportation stipends in this upcoming one. And so we're super excited about that. Like many of you, we do evaluations. We want that feedback, and we do our best to pivot and just improve our services. I tell you what's been great is incorporating a DJ and an MC. We have had the privilege of having former Miss Oklahoma, who's also a sibling, and she's done a great job as our MC, and we've had DJ Lex, as we call him, and incorporating that music has been just a great addition. And we do incorporate those self-care sessions so caregivers feel acknowledged, appreciated, and really just have that self-care time. Of course, we're going to do our best to connect them to Respite and other resources. Next slide. And I've got 10 seconds left. Next slide. Okay, thank you. So data. It is so important. And any partners that are on the call, if you want to set up a meetup to talk through data, we are always willing to do that. We do a pre and post survey for our respite voucher program, which has been so helpful. And of course, any event, especially our caregiver conference, we do quick evaluations so that we're having that family caregiver voice and implementing where we can those changes. And we also work strategically with the other statewide respite programs and just want to do our best with care coordination so family caregivers access respite. So that's a lot to be said in 5 minutes and a few seconds over. But again, just thank you for this opportunity. Real quickly on data, we do look at the census data to look across race, ethnicity, and see if we're reaching caregivers of all diverse race and ethnicity. I would highly encourage you, if you haven't done that, Thankfully, we've been able to reach more in terms of the percent, but we are always actively looking at ways to reach all caregivers across the state, specifically in our rural communities as well. So just again on data, if you would like to meet to discuss any of that, we would always love to connect. So Jill, you know me, Jill knows me. I've worked with her for a few years now. She knows it's the labor of love.
It is a labor of love, and I'm so impressed that you stuck to 5 minutes. Congratulations. When this is over at the Q&A, I want to know how you held 5 in-person summits at the same time in different parts of the state. I really want to
Well, I will say team, and partners. So those are key for sure.
Awesome, thank you. And now we're moving on to our last speakers of the day. They're going to tag team it. We have Dr. Nellie Clotter Woods, Executive Director of the Arizona Caregiver Coalition, and Lita Nelson with the Arizona Department of Economic Security. So take it away.
Thank you. Good afternoon, everyone. My name is Lita Nelson. I work with the Arizona Division of Aging and Adult Services with DES. We're the state unit on aging. Next slide, please. Next slide. Thank you. So for Arizona, we are starting the process for really looking at tribal coordination, collaborations. Part of this is driven by the increased, well, with the new rule where we have to and must work collaboratively with Title VI and Title III programs. So the starting phase for the tribal coordination really started with the state plan for Alzheimer's and dementia, which is led by the Arizona Department of Health Services. Now, we did a caregiver summit in Phoenix where it was mostly geared toward urban and more of the populous demographic. However, we knew that there was a need to also complete a summit in more rural areas. So we did a focused one in Window Rock, Arizona, which is on the Navajo Nation. On the map, you'll see that there are a number of different tribes throughout the state, tribal lands, as they call it. We made sure that we tackled the one that had the biggest population of Native elders. So for the summit in Window Rock, there were over 100 attendees. They came from, Navajo, Hopi, and Zuni tribal communities. And I think this is important to highlight because there was a need for information, resources sharing, and even programs. And we know that in the US, the population for American Indian, Alaska Native tribe have increased about 30% in the last 10 years, starting in 2000 up to 2010. So really, it's going to be a lot of work and outreach, not only for rural and tribal communities, but also urban Native Americans. So the fact that we're now crosswalking 2 different state plans, one with the dementia state plan and then the other with the state plan on aging, and really tackling between 2 different governmental entities how we're going to ensure that we're serving all individuals across the state for a number of different diagnoses and their family caregivers. So the considerations and something that was really eye-opening is that although I am Navajo and I don't live on the reservation, I live in Phoenix, really attending the summit in Northern Arizona was an eye-opener because we know that now the respite in its traditional sense will not work in tribal communities because they do have the mindset of we take care of our own, but there was need for skills building and training. So that is where we're going to put focus related to respite. Defining family caregiver and Native communities is very different than how we would also see it across other populations. Inclusivity, we definitely want to have tribal leaders and other community advocates at the table to help us guide, policies and to develop policies that work in tribal communities. And of course, the increased collaborations with 6 and 3. How can we do more and more with less, funding than is needed? And with that, I'll go ahead and turn it over to Dr. Clodder-Woods.
Hello, everyone. That was great. Lita, thank you so very much. I wanted to talk about Goal 2, building of partnership and engagement. And this is our efforts here is stemming from following the national priorities and coordinating caregiving issues, addressing gaps in services statewide. So with that, just wanted to share with everyone that we also got funded from the by 2 grants, the Vitalist grants, local Arizona Community Foundation grants, and the Arizona Impact for Good grants to lead the effort on continued conversations and hopefully developing collaborations amongst about 17 entities statewide here in Arizona. Here I have a dozen, but it's actually 17 entities, agencies. Most of them are community-based entities, and some of them are governmental entities, getting together to talk about service gaps and issues, caregiving issues throughout the land of Arizona. These entities represent areas of the elderly, the deaf and hard of hearing communities, Alzheimer's and dementia, children with disabilities, veterans, and more. And the hope is, before I share with you what the hope is, I meant to share that the Vitalist grants and the AZ Impact for Good grants actually was awarded to hire on a facilitator, a consultant, to help us through these discussions. And in the next 12 months, the hope is that the discussions will build on vision building, casting, strategic planning, peer-to-peer support, and information sharing. Again, the goal is to hopefully gain collaborations or build on further collaboration or advance on collaboration to discuss caregiving issues. Next slide, please. Another initiative that we are so proud of is our emergency respite booklet program. It's actually funded by the local here in Arizona, Maricopa County, to serve those living in the Maricopa County area. However, we're hoping to, again, this is a pilot program, and we're hoping to advance this through the Lifespan Respite program statewide. And this emergency respite booklet is for an advanced care planning, and its emphasis on client-centered care. It prioritizes individualized needs, preferences, during any kind of discussion of medical treatment, care, and personal wishes forefront, during the healthcare decision making. So right now, how it actually looks, if you can visualize this, is our current staff member goes into the community, senior centers or community-based agencies, and talk about preparation of the emergency respite booklet. And it's a neat tool, actually. It's laminated, and there's markers involved, and one put in their information, medication that they may be taking, and again it highlights their personal wishes on how they can be cared for during a time of need or an emergency. We do have a video to show, and I don't know if we're in time for that video. Are we in time, or?
Yeah, if it's not too long.
Think so. If it is, just cut it off at time.
I didn't know that there was a video link there. I'm not sure we can access it from
Oh,
live.
well,
Let's try it.
Oh, sure. Is it there? Well, I can send a video. Oh, looks like it's.
I'm sorry, Nellie, we weren't quite prepared to
Oh, that is quite.
show
Oh,
that. Oh, there it goes.
something is
Can't do
happening.
anything.
And again, cut it off at the time allowed it. I think it's.
All right, perfect. So we'll go ahead and get started. My name is Heather, and
You might have to.
This is 45 minutes long.
Oh, well, for anyone that's interested in learning more about the emergency respite booklet and how to craft it and all that, there is a link in that PowerPoint, and at your leisure, go ahead and review it. That's all I have.
I just put the link in the chat, so if anyone wants to go and has 45 minutes to view that, please do.
Thank you both for sharing the highlights from the work you're doing in Arizona. It's really far-reaching. Thank you both. Actually, that is the conclusion of our Bring, Brag, and Borrow sessions, and we seem to have finished right on time. So we do have plenty of time for you to ask questions, make comments, engage with your colleagues. I do want to thank all of you for these very incredible presentations, for the incredible work that you're all doing to advance respite and aligning all of the work that you do with the national strategy to support family caregivers. We're so proud to have you as our ambassadors at the state level to make this all work. So again, my sincere thanks and appreciation for everything that you're doing and for the great presentations. Oh, okay, does anyone have any questions or comments? Feel free to come off mute. Do I see any hands raised? Susan Summers has a question.
No, I was trying to hold back, but now I have a burning question for Aida Stevens. Actually, I have two questions. One, I loved that you have great representation across populations for the conference, and I'm wondering what accounts for that. Like, how'd you make that work? And the other question has to do with what I think you probably have some great outcomes after the conference, like that this has a ripple effect. So I'm wondering what you see outside the conference that you can attribute to bringing everybody together.
Great. Thank you so much for those questions. So really with intentionality in having diverse populations and trying to reach caregivers across the lifespan. And I think what's been shared throughout today's presentations is really just doing better and have that intentionality and representation. I think there's a lot of thought and effort put into that because we just have the commitment and obligation to reach everyone. I myself am Kiowa, and I know personally I want to reach more Native American family caregivers. But our team as a whole, with unique perspectives, experiences, many of whom are also family caregivers, I think just together with that commitment, we're just trying to do better and reach everyone. And I'm sorry, the other question, Susan, I should have wrote it down.
No, that's okay. I just think it's so powerful. You have such great attendance and you do so many things to support attendance of caregivers. So like they must just feel really valued.
Well, and there's just nothing like the day of to see one that's like, oh my goodness, like no one ever thought to, thank me or do this for me. I didn't even know about whatever that is. So it can be a great conversation to connecting to respite and other resources. But we also don't want it to just feel like another training, another, more formal conference, which nothing against either of those. Those are great platforms. But again, we want it to be fun. We want it to infuse that self-care, the wellness. The picture of the massage So of course, that picture was specifically taken here in Oklahoma City, and we did not have a time slot for every caregiver. So what we ended up doing is like a drawing. So many caregivers could have a chair massage. I think we ended up with like 65, and they were randomly selected. So you can get creative, even if not every participant can access maybe one activity. It's just maybe a prize for those that can, but having conversations about their self-care, their wellness, it's equally important to their loved ones. And just, not for them to feel guilty, but feel appreciated. And that's really, Susan, I think you touched on it. Some of those outcomes we've seen where they've made connections with other caregivers. They have perhaps accessed respite vouchers either through Lifespan or through another statewide program. So those are those positive outcomes that we can only hope to achieve.
Yeah. Thank you.
Anyone else have questions or comments? I think I did see a question in the chat from Rachel would like to ask Yetunde, do they require proof of an emergency? And I guess my follow-up question would be, if you do, what is that proof? Are you still on, Yetunde? I see her, but she might have stepped away. We'll follow up with her, Rachel, and get an answer to your question. And Alexis wants to know, did massage therapists donate their time, or how were chair massages paid for? Oh, Aida answered that already. We did have to pay a discounted rate for the chair massage.
Yes, and honestly, we always look also for for-profit sponsorships. I failed to mention that. We do have for-profit sponsorships available to help offset those costs. We also partnered with Oklahoma Healthcare Authority to access some funding to offset costs for speakers, space rental, food. But yes, unfortunately, if we can't get it free, we're going to ask for a discount. And a lot of times, it doesn't hurt to ask. Sometimes you'll be surprised. You might get massage therapists that would actually donate their time, but that specific one, we did pay a discounted rate.
Anyone else? Comments, questions? Lori has a question or a comment. Oh, we can't hear you. I'm sorry.
Headset finally died. Okay, can you hear me now?
Yes.
Awesome. I have so many notes. I have, what a wonderful day. Everything. I mean, I'm just like, I can't wait to pull down the PowerPoints and so many ideas and so much great stuff. Sorry, I get so excited. I do have, oh, I love the regional respite advisory councils. That sort of sounds like how you could do a summits in multiple places at one time too, if you're collaborating like that. To me, there was, kind of some similarity in that. In Massachusetts, how did you get, who provided that? Was that your state legislature, the 18 million? I mean,
I think Lisa, is there somebody else from Massachusetts? I think Lisa had to leave.
Oh, okay. Well, that's a lot of
Amy, are
money.
you still on? Well, I happen to know it was ARPA funds.
Oh, American Rescue Plan.
Yes, yeah.
Oh, what a great use of that.
Oh, it's amazing. And we're going to have a couple of these innovative programs that were funded at the national conference presenting. And I haven't announced this yet, but one of the other programs, a parent cooperative type program, is going to be presenting at our volunteer and faith-based collaborative in July. So they're just going to be spawning so many innovative respite models in Massachusetts, and we're going to stay on top of it and try to share those models with all of you as they start, getting started and start collecting data and have information to share. We'll be sharing that with you.
I have one other question if I may.
Go ahead.
Oh yeah, Tammy's still here. One of the respite task force goals, and I'm very interested because I co-lead the advisory councils and I'm the main lead for the Grandparents Raising Grandchildren Council. So I've done have a lot of background work and what led us to the strategy and stuff. And clearly your task force, I mean, everything here is like super exciting to see how you guys are advancing things in the strategy. But the one of the 3 goals was expand data research and evidence-based practices to support family caregivers. Can you give me just pure curiosity, an example of what that might be or what that would look like? I mean, you have tools you're using, or, I mean, this is in infancy, I understand, but I thought
Right,
that was
I think that's a great question. And that committee meets this week, and I am not sure where that is headed.
Can't wait to find out in next year's Bring, Brag, and Borrow, maybe. Because I love Bring, Brag, and Borrow. It's one, and yeah, anyway, and I just want to thank everybody for everything you do, the hard work. Even if you didn't present the Bring, Brag, and Borrow, I know you got something you could bring, brag, or borrow about, and it's just the most amazing just project writ large that I get the good fortune to work on. So thank you all very much.
Anyone else? I have a quick, I'm sorry, go ahead.
I was just curious about the respite care funding for tribal nations. On the listening sessions, I missed how many that were held and were they held across the state?
Yes, they were held across the state. All 11 tribes were invited, and we had 2 different sessions, and they were recorded and sent to individuals who couldn't make it.
I'm amazed at how many of you are doing such excellent work to engage diverse caregivers across the state, and we have so much to learn from all of your efforts. We'll be able to document, maybe we can do a whole report on it, lessons learned from this work, all this very important work that you're all doing. I do have a quick question for Sarah Schmidt from Arkansas. I am very impressed with the funding that you're using from your social services block grant for respite, I believe, for people with Alzheimer's. And I'm wondering what it took to make that happen. The social services block grant is certainly a fairly large pot of money that states have that they can use as very, very wide discretion, but because of that, it's also highly competitive for those funds. I'm wondering what it took to make that happen. It would be very illustrative for other states.
It is very competitive for that funding. And we have a very, very active Alzheimer's Association here in the state. And through several discussions with them, they took the initiative to go to the state legislature and request particular specific funding through DHS. And so they were able to pull down some of that funding from our SSBG grant to give them outside of our lifespan respite grant. So that kind of gave us a little extra. I think we do about 200,000 every year to them through the SSBG. So we like to say that we supplement our lifespan respite with dementia through that funding as well. But the way that we do that is, like I said, they any Alzheimer's or dementia diagnosis that we get in through lifespan, we refer it over to them first because they are tracking a lot of data just statewide on those diagnoses. And then once they run out of funding, they do every year, usually about February or March. Then any that they get coming into them, they feed back over to us, and then we start funding it through the Lifespan Respite Grant. And then we share that data with them, and they share their data with us.
Very interesting. So the Alzheimer's Association actually administers those funds. They don't feed into your voucher program to
Correct.
to feed
Correct.
that. Okay.
Mhm.
Very interesting. Arch does have a document called a Federal Guide to Funding. So if you're ever looking for all the possible federal funds that flow into your state that have the potential to fund respite, and you think you might have the advocacy through your coalition, or through a partnering agency, you know, like Easter Seals or the Alzheimer's Association, that's freer to be able to do that kind of advocacy. That guide can be very useful to you. Lori?
I wrote this in the chat, but I wanted to say it out loud. Sarah Schmidt, this Camp Alder something. The fact that they serve children, people ages 6 to 35 is something that is foreign to me, which I think is super awesome. Because I live in Maryland. Here in Maryland, it's like everything is school age or not at all. And so I have a 32-year-old daughter who's a person with autism, and there's nothing like that for her. And so it was just very exciting to hear that. And there's some camp certification. Is that a national thing where you could, part of this is professional, part of it's personal, I'll have to admit.
Yeah, I'll be honest, I don't even really know all the details, but I would be more than happy, and I'm sure they would be more than happy to share it as well. I know that they started back in, oh gosh, I think the 1940s.
Holy cow.
Doing camps.
My language.
Yes, and then over the years, I think in the 70s or something like that, they decided to start specializing in medical type camps, and then kind of spawned into respite for special needs. But they try and they've developed now to where they will do certain types of camps for different diagnoses and different age groups, and they kind of tailor to those. I will look and see it. I know they sent us a narrative on their programming and all that when we did the sub grant. But I am sure they would be more than happy to talk or just kind of share how they've kind of built this. We've been after them for several years, and never been able to catch them. And then finally, it was like lightning just struck, and they found us. We said, well, we've been trying to get a hold of you guys and partner for several years. So we finally made it happen.
And we do have several grantees that offer like respite weekends, you know, sort of in camp or nature type situations. But I don't, and you know, Jill, Susan, Cassandra, you guys know way more than I do, but I've just never heard of a camp that specializes like that and to such an extended age. It just fascinates me that such a thing exists. Retirement project. Thank you, Sarah.
Sure.
I just wanted to add, Lori, there are a lot of programs in Europe that have camps for all ages, adults as well, so that we learn about through the International Respite, group.
Yeah,
we have a listing on the Arch website too of similar camps. On the how to find a respite provider, I think there's a link to a couple of pages that link all different kinds of camps for all different ages.
Oh,
Easter Seals also tends to sometimes run camps for adults with disabilities. And I know Kim Whitmore, who does everything under the sun related to respite, also runs or started a camp in Wisconsin for adults with disabilities that she still volunteers for every year. I'm sorry she's not on the call to tell us about it, but we can get more information from her too.
Yeah, South Carolina has several camps for people with adults with disabilities. One is through our Recreation Commission here in the Midlands, and then I think Clemson has one too. And we do vouchers, camp vouchers in the summer. But there are several camps that do adults.
Awesome. Awesome. That would be wonderful for my daughter. In Maryland, at least as far as I know, you have to be receiving other services. I've tried to private, not camp, but just like a day program.
Right.
I've tried to private pay and they don't, as far as I know, from everything I've found, they don't take private pay. It has to be state funded. So I love this idea of there might be, sorry, now I'm getting too personal, but also it's respite related. It's like,
absolutely.
This is personal for all of us, Lori.
Yeah, well, this is true, but
it's hard to separate it out.
Yeah, all the presentations, I mean, I learned, so I told Jill I was taking all kinds of happy notes because there's so much great stuff going on, but this camp, and thank you so much. I mean, I'll have to hit the website. I'm on the website a lot. Love the website. Love the new look of the website. Love the search engine. It works fabulously. Oh my gosh, it always takes me to where I want to go. I love it. But I will have to go search camps and I will find exactly what you told me I would find. Thank you.
Well, thank you all again. I want to echo what Cheryl Donnell just put in the chat, and she said, I'm so impressed that so many of you have been with Lifespan Respite for only a year and are producing such marvelous work. Well, thank you for your fresh enthusiasm and perspectives. I really want to echo that. I was a little worried yesterday when I saw nearly 50% of you, or it was a fairly high number, maybe it was a quarter of you, had been with your program for less than a year. And still, the what's happening is just truly amazing. And I'm always amazed with what you all do with such a small amount of funds to begin with. And small staff as well. So again, thank you all so much. We are coming toward the closing of this, and Marcia just put in the chat one last question we wanted to pose of you before you all drop off. You can either come off mute or put it in the chat, but share with us one specific new idea, activity, or resource that you learned about during the last 2 days that you might actually use in your work. We'd love to hear about how these ideas will become reality in your state if you're thinking about that. Feel free to come off mute or put it in the chat.
Well, it doesn't apply to me. Well, it may. I'm writing but there's so many ideas. I feel like I need to process some of this information.
Me
It's like
too.
there's so much good stuff. It's like, ooh, a little bit of this, a little bit of that. Wait, what can I fit in? It's just such a broad range of information too. Sorry. Love this stuff.
Well, again, I'll let you all go a little bit early. You've been so wonderful to give up so much of your time during your very, very, very busy work week. So again, thanks to all of you for presenting, for doing amazing work in your states, for sharing it with us. And one last request, if you wouldn't mind just taking a quick survey and letting us know about the event and what you learned from it. We'd love to hear from you. I put the link in the chat, but I'll also be sending you an email if you don't have time to respond to the survey right now. Any last thoughts or comments from anyone? We are so looking forward to, I hope, seeing all of you in New York in less than 2 weeks. Just so excited about that, I can't tell you. To have our in-person meeting and then the whole conference. And I neglected to say, for those of you who have not been to the conference before, in addition to the Lifespan Respite Learning Symposium on the first day, we do have a Lifespan Respite track that runs through the whole conference. And I think we have 7 or 8 lifespan respite presentations from lifespan grantees and partners. And I'll try to put that together in a document and share that with you in advance so you'll know which ones. They're indicated that way in the program, whether they're a lifespan respite track or not, but those might be sessions that you might be particularly interested in, but I'll make sure to put it together so you have it in an accessible, convenient location. Okay, everyone, thank you so much for a great 2 days, and we'll see you soon.